If this is what you decide to do about your hearing loss, then you're screwing yourself over. Hey guys, welcome back to the Dr. Cliff AUD vlog. This is vlog number 278, and today I want to talk to you guys about one of the dumbest decisions that patients make when they're in a hearing aid clinic. But before I get into this video, do me a huge favor, click the like button. It really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. Okay, so today's vlog is really all about this concept of I need to think about it. This is a phrase that a lot of audiologists and hearing instrument specialists hear all of the time. In fact, when I was in grad school, I saw a research study that said when people have hearing loss, when they first notice their hearing loss and they're ready to go and get their hearing loss evaluated by a hearing care professional, it has already been 7 years of having that hearing loss. And then it takes that long for them to really come to grips, for them to go in and finally admit, yes, I'm having difficulty hearing, I'm gonna go get it tested. And so what happens is that you get these individuals who come into the clinic, they go through a comprehensive evaluation, they are told that they do in fact have a hearing loss and that the vast majority of the time, the treatment for that hearing loss is hearing aids. Sure, there are occasions where there are other treatment recommendations like earwax removal, surgery to correct an issue with the ear, surgical implant like a cochlear implant or auditory brainstem implant, what have you. But in most cases, I'm talking 9.5 times out of 10, if someone has a hearing loss, the most appropriate treatment option is to treat their hearing loss with hearing aids. But here's the other thing that I learned when I was in grad school. Only 50% of people who have a hearing loss say yes to treating their hearing loss with hearing aids. And when I first heard this, I'm like, that is the craziest statistic I think I've ever heard. Who in the heck actually has difficulty communicating to the point where they're willing to go in and have a hearing evaluation, be told that at that hearing evaluation they have a hearing loss, and that the appropriate treatment option for the hearing loss is a hearing aid, and then still choose not to do anything about it? This, to me, I kind of equated this to like cancer, and this was my naivete in grad school, is that if people have cancer and they go in, or they're having some issue with their body, they go into the doctor, they run some tests, they identify, oh, you have cancer, and if you address that cancer right now, the chances of you going into remission with that cancer are substantially higher. And that person is still like, you know, I think I need to sit on it for a while and kind of come to grips with this whole idea that I have cancer and that I want to do something. Now, I can understand to some capacity, you're getting a bomb dropped on you when you have a cancer diagnosis, and maybe it's the same type of thing with the hearing loss diagnosis. But the same thing is true with hearing loss, which is if you have a hearing loss, it is much easier and better to treat it now than waiting another couple of years or even a couple months down the road. In case you haven't been paying attention, there is a lot of research out there now that shows that individuals who do not treat their hearing loss are at a higher rate of cognitive decline, which could potentially lead to dementia later in life. Now, do I think that you should treat your hearing loss because you're freaked out about dementia later on? No. Now, some people do choose to treat their hearing loss for that reason. I think that the biggest, most important reason that people should be treating their hearing loss when they have it is that first and foremost, they've already had that hearing loss for quite some time. And your brain is in auditory deprivation. There are changes that literally happen inside your brain structurally in order to help you process what you are not hearing. So essentially, you end up relying more on other areas of your brain to compensate for the hearing loss that you have, and that is not good from a long-term perspective. On top of that, you end up running into issues from a communication standpoint. There are a lot of studies out there that show that individuals with an untreated hearing loss actually make less money and are less successful in their career fields. Not to mention all the other aspects of higher rates of depression, social isolation, what have you. Now, getting back to the point of it being a bomb being dropped on you, I totally understand that concept because you go in, you have some suspicion you have hearing loss, unless you're being forced by a spouse or significant other to go in and get a hearing test because you completely deny it. But nevertheless, most people have some understanding that there's difficulty when it comes to communication. They go in and they have a hearing test with the hearing care professional. They tell them they have a hearing loss and that the recommendation is hearing aids, and they kind of were like in denial to some capacity that they would actually have to treat their hearing loss. So I can understand that. But the problem is that if you leave the office of the hearing care professional that you are working with, it is usually years before someone goes back in and says that, you know what, I think I need to actually treat my hearing loss now. The problem is that your hearing loss can actually get worse faster. And I'm talking about the comprehension aspect of treating your hearing loss. So let's think of it like this. If you have a hearing loss and the X's and O's are down on the graph, meaning you have more hearing loss at certain frequency ranges than others and more severe of a hearing loss, that doesn't necessarily mean that if you treated the hearing loss that those X's and O's would slow down from dropping on that graph. Now, what does slow down is the comprehension scores that you have. So if we replace all the missing speech components that are caused by the hearing loss, you essentially get to maintain a higher level of processing of what you're hearing. So your word recognition percentages stay higher. If you do not treat your hearing loss, the percentage of which you can comprehend what you are hearing when it is replaced at some point in the future drops a lot quicker. So it is literally a horrible decision to postpone treating your hearing loss. Now, I will take some of the blame for this. In fact, I think that my entire profession of both audiologists and hearing instrument specialists should take some of the blame with this, because we are horrible at communicating the urgency to individuals to treat their hearing loss. Like I said, it's usually already been several years that they've had an untreated hearing loss, meaning they've been in a state of auditory deprivation for years at that point, and we are still not good at articulating the potential negative ramifications of continuing on that particular path. So having a treatment acceptance rate of 50% is just like the worst thing in the world. Now, my personal treatment acceptance rate is 90%. Now, I've been accused by patients of saying, you know, you're so good at communicating the urgency and the capacity to treat this hearing loss that how does anybody say no to you? And just to be clear, years ago, I was a 0% treatment success person, meaning that 100% of people who came in to see me to get their hearing tested and be recommended hearing treatment, 100% of those people said no to treating their hearing loss because I was so bad at communicating what their hearing loss was to them, how it negatively impacted their life, what would happen if they didn't treat their hearing loss at that moment in time moving forward. And I have gotten substantially better at that because I know that people make emotional decisions, not logical decisions. If everybody made logical decisions, then our treatment acceptance rates would be 100%, because the negatives of not treating your hearing loss are so bad that if you understood what it meant to wait another 5 years to treat your hearing loss, then you would not wait. You would actually say, you know what, I'm treating my hearing loss absolutely right now. And there's a reason why people who wait decades to treat their hearing loss end up sucking with their hearing aids. They basically screwed themselves over throughout that entire time period, wanting to postpone it for whatever reason. Now, again, I'm going to sympathize here a little bit with the financial aspect of treating your hearing loss. Yes, there is a financial component to that, but you have really low-cost options out there like Costco. You have non-for-profit organizations out there who will literally give you hearing aids and fit them and program them and all of that for you, and yet people still say no to doing their hearing treatment. I remember when I went down to a give day. A give day in the world of hearing aids is when you're running a nonprofit organization, everyone is prepped and ready to go, meaning that you've got 50 patients or 100 patients on the schedule, and all the patient has to do is show up, you've got the hearing aids, you're going to fit them with the hearing aids, they get them completely for free, and then they go home and they can hear, and they even get some follow-up care after that as well. And the no-show rate for that is massively high, and I'm thinking like, if people are getting free hearing aids, then why are they not coming in and getting those free hearing aids? Now, maybe there's something else going on, but it just doesn't make any sense to me. I mean, even when you look at other countries that give their citizens hearing aids for free, their hearing aid adoption rates are only 10% higher than what they are here in the United States, and they're free. So like, I really don't know why people are choosing to screw themselves over when it comes to actually treating their hearing loss. Now, I mean, there might be some level of stigma. I doubt it, because stigma is virtually dead at this point. You can't hardly see hearing aids nowadays. And a lot of people now who are wearing hearing aids really don't care if you can see their hearing aids. Like, we all got problems, right? Nevertheless, I'm kind of getting off base here. The thing is that it is our responsibility as a profession to make sure that we're communicating the value of treating hearing loss for an individual. That's why we spend so much time training on this inside of the clinic, because I don't want people who come into our clinic to basically be like, you know what, you've given me a lot of good information here. That's a lot of food for thought. I'm going to go home and think about it. And then you know what happens? 100% of the time they go home and think about it and they don't do anything about treating their hearing loss. And so I see that as a failure on the professional side. And because we don't spend enough time being able to training on articulating the value of hearing treatment. It is essentially our fault for how many people need to go home and think about treating their hearing loss. But I want to hear from you guys. Are you the type of person who, when you first went in to get your hearing tested, that you told the hearing care professional, you know what, thank you for all this information, I need to go home and think about it? Or are you the type of person who's like, yeah, totally makes sense, I should definitely be treating my hearing loss, I'm going to go ahead and move forward with your treatment recommendation? I want to know down in the comment section, and as always, guys, I'll see you next week.